We know that the more we better understand the individual that we're treating, the better the outcome. So you then begin to say, can I demonstrate that I care about you, not just for you?
It's just rewarding to see that I can make that little bit of difference in their lives.
I feel blessed having the Guardian Angel program on my unit.
It's definitely something that completes what I've set out to do in my life, and that's to make a difference in some way.
The motivation for starting the Guardian Angel program pretty much evolved from seeing that there was a need for the patients to have an outlet to talk to somebody other than what the medical diagnosis is, what treatment they're going through.
Good morning. Hello. Hi, Virginia.
I was actually approached a couple months prior to starting the program on my unit. I thought it would be a good addition to the unit to have someone who's non-clinical be involved in the patient's stay at the hospital.
It's part of our mission here that we're going to heal the person. Obviously, we're a medical center, so that's what we do. But it's just as important to us that we heal the individuals spiritually, mentally, and we pay attention to that side of them as well.
We want to connect with every patient every time, and this really does give us the opportunity to reach out and connect with individuals.
The Guardian Angel program involves employees that volunteer. It's very important to understand that they volunteer their time. They're not paid to do this program. They're assigned one specific room, and to that room they go every day, introduce themselves as the Guardian Angel. What can I do for you?
And we just start talking.
So has your husband been in to see you?
Oh yes, he comes in every day, and I see my children almost all the time too. And I'll be glad to get home and visit back with him again.
Is he retired?
Yes, he's been.
I just try to not focus on what they're here for diagnosis-wise, but who they are, where they come from, and what their background is, and if they're retired, what they did when they worked. And we just get into sometimes a 30-minute long conversation.
If they just want someone in there just to sit with them, a companion, if they just need to vent because of situations going on, I'm there.
What's on my mind is to try and reach the individual on a personal level, to make them feel as though they're the only patient here in the hospital.
Oh, you know, I remember the other day we were talking about your grandson making the baseball team. Did that happen?
Just it did. Thank you for that. You remember.
The benefit I feel the patient gets is they have one person to talk to, one person to communicate with, the pros and the cons of their stay, anything that we could do different, anything we could do better, what we are doing good. They have one person to connect with that they can talk with, and they know that I am going to go that extra mile for them if needed.
I met with a lady who had no family, and her biggest concern was her animals at home. And this was the first day she was admitted, and she had no one to go take care of those animals. So as a Guardian Angel, there's a lot of resources we have available to us. So we contacted social services to find out if there was somebody that could go and visit the dog, take the dog out, and they ended up contacting a neighbor who she felt comfortable with, and the neighbor then went into the home, took care of the animals.
I've had one who was very ill and couldn't even speak, but the wife was there, and I spent a lot of time talking to her and comforting her, and then we were laughing by the end of it.
You're not just a patient here with a number and a medical record, and we're going to send you and send you on your way. No, we care about you. We want you to know we're here for you.
Have you met your Guardian Angel?
Yes, she's really nice. She helps get me a newspaper and brings up little puzzles for me to do. It's just really, and then she really listens to me. She's a great lady.
People say, wow, I'm a participant. I really get to see this thing firsthand, and my life is being impacted.
I don't do it for myself, but oftentimes I feel that I get more out of it than the patients may.
Every time you meet a new patient, it's something special because you learn something from that patient.
I get to be a part of what we do here. Even though I'm not clinical, you don't have to be clinical to make an impact on the patient's recovery.
Don't hesitate to call me, okay? And the nurses know how to get a hold of me. And if you by chance are still here after today, I'm going to stop up tomorrow and check in on you and see how you're doing. And know that I also keep you in my prayers, okay?
I know that I accomplished what I set out to do when I get even a simple thank you and a hug at the end of my visit.
I am just overly impressed with my team. The Guardian Angels are just a phenomenal group of people, and I couldn't be more proud of them. My goal is, to have every patient in this hospital feel like they have somebody looking out for them over and above their doctor and their nurse, somebody that really is there to take care of them.
It really does put our mission into action, and I feel that the patients leave here being cared for as a whole person.
I can see it, flourishing, and to spread it amongst everybody in the hospital would be phenomenal.
Hopefully other hospitals start doing this because it will help so much.
I only have one word for it. It's really, truly powerful.